had to discontinue Rinvoq and go back on Cellcept, so let's just get into why that.
She's a Mona Lisa.
Rinvoq is an RA medication, but it's currently in a clinical trial for lupus patients. So I have to tell you, I had a lot of side effects on this medication. When I started it, I was titrating off steroids, specifically prednisone. So I thought it was working pretty well. And as I titrated off the steroids and just the positive effects of the steroids started to wear off, I started noticing that this medication was actually doing absolutely nothing for me, and it had some pretty nasty side effects. Also, I just want to note that this medication carries a high risk of blood clots or cardiovascular events, so that's kind of scary. But the side effects that I was having are chest pain and heart palpitation, shortness of breath, coughing, and weight gain. Now, the weight gain started on the prednisone, but usually when I discontinue the prednisone within a week or two, the weight comes right off, and that is not happening this time. If anything, I've gained a little bit more weight, so you could kind of really see that I don't look right now, and my face is quite swollen, and I've gained like over 10 pounds. It's a nightmare. And I've noticed a ravenous appetite. Like, this is a complete opposite of what you deal with on Cellcept, where you have like no appetite at all. I've been on the Rinvoq for just under a month at this point, and I had something weird kind of happening to me the past, I would say, week. So I noticed that when I was walking, the muscles in my calves were getting very, very like tight, and it was just very weak, and it was really hard to walk. And this happened maybe 2 nights ago, where it was quite severe. Now, when this happened, I wasn't walking or doing anything. I was actually sitting at my desk working. So I had been just sitting most of the day. I did no walking or strenuous exercise. And at that point, I'm like, absolutely not. I'm not taking this medication anymore. I messaged my rheumatologist and told her what I wanted to do, and she agreed. And at this point, I'm going to go back on Benlysta and Cellcept. So, to be honest, the B-cell targeting agents are the only things that have worked for me. There's really a lot of overlap in my symptoms, and I think that happens to a lot of us. So I have a lot of lupus symptoms, I have a lot of RA symptoms. I don't know why the B-cell targeting agents seem to work best. I just know that there's only 2 medications that target B-cells that I know of, and that's Cellcept and Benlysta. I have tried Benlysta because it worked so well for my lupus on, I think, at least 3 or 4 different occasions. I was using a mood stabilizing medication to try to mitigate the side effect that I had of severe depression on Benlysta, which is a black box warning label with that medication. And it worked for a while, but it didn't, after a couple months, it started not working anymore. So at this point, even if I have to periodically change medications to mitigate that side effect, if maybe I have to specifically use an antidepressant or anxiety medication or something to keep me calm and just chilled out, and certainly some lifestyle things to just keep my mood good and even, I think I'm going to do all of these things, really. I just feel at this point like I need to do whatever I can to be able to stay on Benlysta and Cellcept, because they're the only things that have worked for me. And if you guys have been on here for a while, you know I've tried Imuran, methotrexate, Safnilo infusions, Arava, and now Rinvoq. Well, there might be some others I'm forgetting. God only knows. So, I mean, I've tried a lot of different medications and nothing else is working for me. So I will keep you guys updated. Just because this medication didn't work for me doesn't mean it's not going to work for you. I just want to come on here and be honest with my experience and you know, if nothing else, if you have this experience too, at least you feel validated and you're not afraid. Because I know when I first got diagnosed, there was no information out there. I had no idea what I was getting myself into with these medications they wanted to put me on. They're really serious medications that come with some really serious warning labels and side effects on them. And it was horrifying. It was really scary for me because I could not find any information out there. So I hope you guys got some value out of this video. And as always, stay strong. And thank you for all your likes, shares, comments, and subscribing.